G'day everyone, welcome back to the channel. Today we're going to go through the top 3 exercises to treat ITB syndrome, so iliotibial band syndrome. And as always, we're going to break it up into sort of 2 parts, where the first exercise that we're going to go through is more of a symptomatic treatment, something to help that ITB feel better quickly. And then at the end, we'll go through 2 more exercises that are going to get to the root cause of ITB syndrome. And one of the things that we see a lot clinically is that we're very good at targeting the ITB itself and trying to treat that through a number of different reasons. But as an industry, sometimes we neglect or lose sight of the bigger picture, and we sort of forget that, yes, that knee is sore, but it's not just a knee floating around in space on its own. It's sort of sandwiched in between the rest of your leg, essentially. So if we're not taking a step back and looking at how the rest of your leg functions, it's very hard for us to optimize how quickly that ITB goes away, but then to cure it, which is at the end of the day what we're all here for. So one of the things I wanted to talk about first though is the way we look at treating the ITB itself. That symptomatic treatment in itself can sometimes be misplaced as well. And we look at the ITB as like, I guess, another muscle that gets tight. So you'll hear about ITB stretches, and exercises that target sort of the mobility of the ITB. So the interesting thing about the ITB is you can't actually stretch it. It's not a muscle that can be stretched. It's just a thick sheet of tissue that acts as a support structure for the muscles around it. So your quads, your hamstrings, and your glutes at the top of the hip, they insert into the ITB itself. So while you can't stretch the ITB, which is more similar to a steel I-beam that just inserts into the side of the thigh basically, what we can do though is go after those tissues that insert into the ITB. So if something's become irritated sort of at the top corner of your knee, and we always, if you're confident that it's your ITB, we don't necessarily want you to be digging a ball or a roller into that tissue specifically if it's annoyed, but we can go to the tissues above and below that, or in front and behind that, free those up and feed some slack into the ITB that way. And it can be really effective at sort of decreasing the symptoms of your pain without necessarily putting pressure on the actual spot that's annoyed. But what we mean by that basically is that with your trusty foam roller, this won't be news to anyone, but instead of basically, as I said, instead of rolling around like we've done for so long, we want to be a little bit more sophisticated, and we want to look at it in terms of corners. So the front corner is sort of where the quads attach to the ITB. The back corner is where your hamstrings attach to the ITB. So what I'd like you to do to start with is we're going to go for the back corner where the hamstrings attach. So if you start dead on the side and just roll backwards a little bit, you should be able to find a position or a spot where that might feel tender and tight. Now, one of the things that we often do incorrectly with a foam roller is, despite the name, we tend to roll a lot. And what we find clinically is this isn't the most effective or the fastest way to make a meaningful change to a tissue. We need to come at it a different way. So what we want to do instead is, once you've found some tightness, so for me that feels a tiny little bit tight and tender there, we want to keep some constant pressure on that. We want to tack that tissue down. And we want to use movement to free that tissue up, to shear that tissue free. Now, in this instance, it can be a bit awkward with the hamstring, so you might want to do it off the edge of a bed or a chair or a couch or something like that, so that you can bend it down a little bit more. But when we get to the front corner here and we're looking at the quads, which is quite tender for a lot of people, so it's a little bit tender there for me. So if you place your other leg over the top, and again, you need to be sort of rolling forward a little bit. If you're dead on the side, you won't be hitting it. You need to roll forward to hit that quad. And then what we want to get you to do is we need you to bend and straighten that knee as well. So this will feel horrible for some people. It's not pleasant, but make sure that you can find a position that you can tolerate comfortably. Don't put any more pressure through this than you feel you can tolerate, but we want to use that movement to shear that free. And what you'll find very, very quickly is that feeding slack into those tissues can really help that knee feel a lot more mobile and far less tender very quickly. So that's the first exercise that I'd highly recommend excuse me, for ITB syndrome. The second excuse me, the second and the third exercises come back to the broader mechanics of how the leg functions. Now, if you've been following these videos, you'll understand how important the squat is at being able to see why these issues occur. And what we want to look for here is people who tend to have ITB syndrome, when they squat, a lot of the time they can't reach full depth. But on the way down, we often see a foot that either wants to turn out or a knee that wants to collapse inwards. And what happens with that collapsing, so if someone's running, you often see this pattern, this wobble in the knee. And what happens is as the ITB anchors into the knee, every time that knee caves in, you're getting this shearing effect. I don't know if I can coordinate this, the shearing effect that happens unnecessarily. So in order to try and treat this and make this go away in a meaningful way, we need to make sure we're looking at what's happening at the ankle and the hip that's allowing this movement pattern to occur. And what we can see at the ankle here, and again we've covered this a lot before, but if your ankle joint is stiff, so it doesn't have to be painful, but if it's stiff and restricted, instead of being able to get out in this really ideal mechanical motion, if you run into some ankle stiffness, the only option your body has if you need more range than you currently have is for that leg to dump inwards and go around that restriction. So it tends to be the catalyst for a lot of the lower leg complaints that we see, just because this whole leg's in a bad position. So we want to go after something that mobilizes that ankle. And again, we love this exercise, and I definitely love this exercise. So if you can get a band, attach it to something nice and secure, stretch it out as far as you feel comfortable. And the idea here is we're just bending that ankle as far as you feel comfortable. So just closing it down. So when we're looking at this from the front, so again, imagine the band's pulling behind. We want to make sure that that knee isn't dumping inwards. And we want to make sure you're not just reinforcing a bad mechanic with the stretch. We're actually interested in getting your knee out as far as humanly possible without your toes and your foot coming off the ground. So for some people, you might find that you can only get to here when you rotate outwards, but for other people, you should be able to get a little bit further. So in essence, we're trying to bend the knee as far forward as possible, but we're also trying to rotate it out as far as possible as well. So it's not a linear stretch so much. We're more going for the corner of that ankle, the outer corner. And we want to hang out here. So stay here for a minute or two. You can oscillate, backwards and forwards if you want to, just to try and force that stiff, rusty joint to give. And then what you should hopefully find is once you've done that for a short amount of time, when you squat down again, you should feel your ability to get down lower, but also to keep your heels down, keep your feet straight, but get your knees out should have improved. And by taking off this handbrake here, we can just allow this to function better. So it's not caught in the middle of this stiffness and this weakness, which we're about to get to, and the knee can be put in a better position. So, excuse me, for the glute aspect here, the reason why it's so important to think of any knee issue, really, not just ITBs, but the ITB syndrome as a knee caught within a leg, is that if the ankle's stiff, it's going to force us into a bad position this way. But if those glutes aren't strong enough, we've got nothing to hold us out in a good position if we can be there. So if you've got the range of motion to get into a good position, but not the muscular hip control to hold you in a good position. So if you're running and you feel like you hit the ground, but you've got nothing to hold you in a good position, stabilize, again, we're going to default into that position. And the glute strength is also quite important because a lot of the glutes feed into the ITB. So if you don't have glute strength or the capacity to stabilize really well at the hip, then it's probably a more direct line to dysfunction through that ITB. So what I like to tell patients is you just want to practice a good squat. So keeping your feet straight, screwing those knees into the ground, creating that rotation without your toes coming off the ground. Keep the position where it's almost like your knees are pointing sort of forward or out, and try and maintain that while you squat. And again, as soon as you feel like you reach your comfortable depth and something starts to cheat, then come up, and then that becomes your safe range to work in. So we want to create this pattern where you're consistently challenging those hips to keep you in a good shape. And then obviously over time, those glutes get stronger and the mechanism that's creating that dysfunction will go away. Now you can make that exercise a lot harder with the booty bands, the band that sort of goes around your knees. It forces your knees to stay out and then targets your glutes quite dramatically. So it's a fantastic exercise. Excuse me, you would have seen the exercises, the other ones like the side lying abduction. We're keeping yourself nice and straight and just lifting up your leg from your hip, or more specifically for this exercise, the clams, where you're keeping everything still and just lifting up your leg, rotating it, feeling it through the glutes, not rolling backwards, staying in a good position. So, excuse me. So those three exercises, again, fall into that concept of making sure that you're looking after the symptoms, treating the knee because it's important, because it hurts, but also having the perspective to take a step back and say, well, there has to be a reason why that ITB has become sore, potentially more so than the other, if at all. And when we look at the mechanics of your leg, we can generally see that there's a pattern there where when you walk, when you squat, when you run and jump, that you're sort of losing the ideal mechanics of the leg without realizing it. So it's not your fault. It's often a sneaky thing that happens based on all the sitting we do, heeled shoes, a bunch of other things that compromise the function of our legs long term. And ITB syndrome is sort of an expression of that broader dysfunction. It's just the thing that doesn't enjoy what's going on with the rest of the leg. So as always, we always want to make sure you feel like your symptoms are under control, but we need to address those bigger picture problems because we want it fixed, we want it gone, we want it to be something that you used to have. So hopefully that's some useful information. If you've had ITB syndrome or have it at the moment, let us know in the comments below. We're here to help, so we want to be able to give you some specific or more specific advice, or as much as you can over the internet, but then hopefully help you to reach your goals and get you to where you want to be. And if you enjoy the video, please feel free to leave a like below, and please subscribe to the channel. It really gives us a boost. It helps us do this, but it also helps these ideas and these videos reach more people and help more people, which ultimately is the whole point of them. And yeah, so the videos are coming out pretty much daily during the week, and keep an eye out for those. And I guess until next time, we'll see you soon. Bye.